Measles was once a disease doctors saw only in textbooks, but in 2026, it's back. For years, strong vaccination programs kept measles under control, but as vaccination rates dropped, protection weakened. Measles spreads through the air and is extremely contagious. One infected person can spread it to many others. Misinformation and global travel helped the virus return to unprotected communities. Measles is one of the most contagious viruses on Earth, a microscopic predator that redefined the meaning of airborne transmission. Unlike many pathogens that require close physical contact, measles is a master of the air. It can linger in an empty room for up to 2 hours after an infected person has left, waiting for its next host. It is so relentless that if a single person has it, up to 90% of the people close to them who are not immune will also become infected. It doesn't just attack the respiratory system, it systematically hijacks the immune system, forcing the body to forget how to fight off other diseases. In the world of virology, it is considered the gold standard of infectiousness, moving through unprotected populations with a speed and efficiency that few other biological threats can match. In 2025, measles cases surged to record highs, marking the highest levels seen in over 30 years. This resurgence was fueled by declining vaccination rates and increased travel, leading to the United States recording its worst numbers since 1991, and Canada losing its measles-free status. Because the virus is so contagious, infecting 90% of unprotected people who encounter it, health officials are urging everyone to check their MMR records. In a world this connected, maintaining high vaccination coverage remains the only way to prevent this dangerous but entirely preventable disease from spreading further in 2026.
Recent outbreaks have sent shockwaves through the public health system as the virus finds new footing in unprotected communities. In South Carolina alone, case counts have skyrocketed, surging from a handful of reports to 558 confirmed infections in just a matter of months. The upstate region, particularly Spartanburg County, has become the focal point of the nation's largest ongoing outbreak, with the virus spreading through schools, churches, and crowded public spaces. As hundreds of students are forced into quarantine and the state's healthcare infrastructure is pushed to its limit, we are witnessing the consequences of declining immunity in real time.
The onset of measles is a master of deception, often hiding behind the mask of a common winter illness. It begins with a high fever, a persistent cough, and a runny nose. Symptoms that start like a cold, but quickly escalate into something far more aggressive. Within days, the eyes grow red and sensitive to light, and tiny salt-like spots appear inside the mouth, signaling that the virus has taken hold. But the true signature arrives last, a deep red, blotchy rash that begins at the hairline and sweeps downward like a tidal wave across the entire body. By the time that rash appears, the virus has already been replicating for days, turning a seemingly simple fever into a full-scale assault on the respiratory system. When the virus moves beyond the surface level, it transitions from a miserable illness to a life-altering threat. Measles can lead to pneumonia or brain inflammation, complications that turn a childhood infection into a high-stakes medical emergency. It is a ruthless invader. For every 20 children who contract the virus, one will develop pneumonia, the leading cause of death for measles patients. Even more harrowing is the threat of encephalitis, an acute swelling of the brain that can cause permanent deafness, seizures, or intellectual disabilities. These aren't just rare statistics. They are the primary reasons why 1 in 5 unvaccinated patients ends up in a hospital bed, fighting for their lives against a pathogen that doesn't just leave a rash, but leaves a mark on the body's most vital systems. While the initial rash and fever are visible, the true terror of the virus lies in its long-term stealth. There's a rare after effect that can appear years later, a ticking biological clock hidden within the nervous system long after the patient has seemingly recovered. This condition, known as SSPE, is a slow-motion attack on the brain that lies dormant for a decade, only to resurface with devastating, fatal consequences. But the danger isn't just in what the virus adds to the body, it's in what it takes away. Measles acts as a reset button for the body's defenses, causing immune amnesia that wipes out the memory of every other vaccine and infection a person has ever had. It leaves the victim standing defenseless against diseases they had already defeated years prior. In the landscape of this outbreak, the virus doesn't strike everyone with the same severity. It seeks out the gaps in our collective defense. Children under 5 and immunocompromised adults are at the highest risk, facing a version of the disease that is far more than just a fever and a rash. For toddlers whose immune systems are still finding their footing, the virus is a leading cause of severe pneumonia and life-threatening dehydration. For those with weakened immune systems, such as cancer patients or those on immunosuppressive therapies, the virus can bypass the usual symptoms and move straight to the brain or lungs, often with fatal speed. These individuals rely entirely on the immunity of those around them, making every dip in vaccination rates a direct threat to their survival. Science has provided us with a definitive shield against this airborne threat, but its strength depends on completion. 2 doses of the MMR vaccine give approximately 97% protection, a level of efficacy that makes it one of the most successful medical interventions in history. While a single dose offers a strong start at 93%, the second dose is critical. It acts as a fail-safe to ensure that those who didn't fully respond to the first shot develop the lifelong antibodies they need. In a world where the virus is constantly searching for a weak link, this near-perfect immunity is what stands between a contained incident and a full-scale community outbreak. It isn't just about individual safety, it's about building a wall of resistance that the virus simply cannot breach. When the body is under siege by the measles virus, the right nutrition becomes a critical line of defense. Proper food and hydration are the fuels that power the immune system's counterattack, helping to rebuild the tissues and defenses the virus tries to tear down. In the fight against measles, vitamin A is the most vital recruit. It protects the lining of the lungs and eyes, significantly reducing the risk of blindness and life-threatening pneumonia. Because a high fever rapidly drains the body's resources, consistent hydration and calorie-rich, soft foods are essential to prevent the sudden crash of dehydration. In a battle where there is no specific antiviral cure, what we put on the plate is what gives the body the strength to endure and eventually overcome. Public health teams are tracking outbreaks in real time. When a virus moves with this kind of speed, the defense must be even faster. Public health teams are tracking outbreaks in real time, using a high-tech command center approach to stay one step ahead of the infection. They aren't just counting cases, they are deploying advanced digital surveillance tools and genomic sequencing to map exactly how the virus is jumping from school to school and city to city. Every new infection triggers a race against the clock as investigators work to identify exposure sites, from grocery stores to crowded waiting rooms, and alert anyone who might have shared that air. It is a massive, invisible operation designed to seal the breaches in our community's immunity before the next wave can take hold. Misinformation spreads faster than any virus. False claims create fear, doubt, and hesitation, and that hesitation has consequences. Vaccines are not opinions. They are tested, monitored, and proven to protect millions. When myths replace facts, protection collapses and diseases return. Debunking vaccine myths isn't about winning arguments. It's about protecting children, families, and entire communities. Because when truth spreads faster than fear, lives are saved. Check your vaccine records today. Don't wait for an outbreak to remind you what matters. Protection only works when it's complete. Take a moment, look at your records, make sure you and the people you love are protected. This isn't about fear, it's about responsibility. Because one simple check today can prevent a lifetime of regret tomorrow.